Fern lived alone in a single room in squalid conditions. He was in a demolition area, and most of his friends had been moved. This led to increasing isolation and neglect, and his general practitioner was only called in at a late stage. His bronchitis had been aggravated, and hospital admission was necessary. His distressed breathing was helped by carefully metered oxygen. A pleural effusion was embarrassing his already limited lung function, and some of the fluid was removed. A peak flow meter shows his poor lung function. Isolated in a tower block flat is our next patient, Mrs. Green. She had a grossly deformed right hip, which prevented her getting into an old-fashioned high bed. She had been sleeping for years on 2 chairs, and as a consequence had developed swelling and ulcers of the legs. Her X-ray shows an old malunited fracture of the hip joint. She was brought into hospital and taught to walk with a lightweight frame. She was shown how to get in and out of bed using a special device in the first instance, and later unaided. When her ulcers had healed, she was able to return home. The hospital medical social worker had obtained a more suitable bed for her. Let us return to Mrs. Clark, the patient with the stroke. 2 weeks later, the investigations had been completed, and her condition was improving. The physiotherapist is assessing the amount of spasm in the limbs. Her balance is tested. Ice is applied to the knee to reduce the spasm. Heat is directed to the shoulder joint, which is slightly painful when movement is attempted. The hip and knee joints are put through a full range of movement. At this stage in rehabilitation, she is very unsteady. This shows when she tries to walk between the parallel bars. Blindness was an additional burden for our next patient, Mrs. Holt, who was admitted with badly ulcerated legs due to being chair-bound for months. She could neither see nor reach her feet, and so had developed grossly deformed toenails. The lesions were cleaned and dressed regularly, and some weeks later she was at the stage where she could wear elastic stockings to prevent a recurrence of the condition. She now begins rehabilitation, training to walk and dress, teaching her to live a normal, regulated life on her return home. 30% of our patients have defective hearing, and Mrs. Holt was checked before discharge. When Mrs. Jones had a stroke, her disabled husband went into a welfare home. Although she made a good recovery, it was clear that she would not be able to look after her husband again. She discussed this with a medical social worker who arranged for her to join her husband. For the first time in many months, husband and wife shyly greet each other. They will share a room in this purpose-built home. This is Mrs. K, who had got into a muddled and neglected state. She proved to have severe myxedema, although she was thinner than most patients with this condition. Investigations in hospital confirmed that in addition to her myxedema, she had a degree of subnutrition. She responded well to treatment with thyroid, vitamins, and good food. As in some cases of myxedema, she was unsteady on her feet to begin with and was given physiotherapy. Her personality improved dramatically with the treatment, and she is now a sociable, lively woman. She will return home shortly. Meanwhile, Mrs. Clark continues to progress. Her balance has improved, and she can now walk with a tripod stick. She is training to go up and down stairs, as she has to sleep upstairs when she returns home. She learns to dress herself, and elastic laces make it possible for her to put on her own shoes. The occupational therapist has shown her how to eat with a combination knife and fork. Modern occupational therapy is slanted to daily household tasks, such as cooking with safety. Simple gadgets enable even the very disabled to do a useful job in the home. Every week, the staff of the unit get together with representatives from the community services to discuss the progress of selected patients and plans for their future. Where necessary, the welfare worker, the health visitor, and the district nurse are included in the discussions, and it is decided which patients will require visits after discharge home. This old lady is fortunate to live in a purpose-built bungalow. The district nurse checks that the transfer from hospital to home has been as smooth as possible and confirms that the patient understands the drugs that she must take. She would call again if necessary. A district nurse visits Mrs. K to check that all is well, and finds that she is now coping much better. The period immediately after discharge is one when a patient can be at grave risk, and all the recovery may be lost due to inadequate social arrangements. The home help is a key person in maintaining the aged and infirm in the community. She is a friend who cleans, shops, collects the pension, and so on. The patients we have seen have had striking social as well as medical problems, but Mrs. Lang had a purely medical illness, bacterial endocarditis, a condition which has been found with increasing frequency in older people. The diagnosis depends on careful clinical observation accompanied by a number of laboratory tests. Once the bacteria have been isolated and classified, the patient can be treated with full doses of the appropriate antibiotic, and there is a good chance of full recovery. And Mrs. Lang, in due course, returned to her own home. Mrs. Allen was suspected of having a disorder of bone known as osteomalacia, found quite frequently in old people, and caused by vitamin C, usually the result of defective diet and lack of sunlight. Her bones were tender on quite light pressure, and her ribs were painful. She was suffering from aching in the back and thighs, and recently had noticed increasing muscle weakness, which made her unsteady on her feet and made it especially difficult to walk up and down stairs. To prove the diagnosis, a minor operation was performed in which a piece of bone was removed from her right hip and then examined under the microscope. The light blue areas are abnormal and show bone which has failed to calcify. She was treated with vitamin D tablets, and the pains and weakness rapidly disappeared. Her ribs were no longer tender, and she was able to walk quite briskly. The simplicity and effectiveness of treatment makes it especially important to recognize this condition. Our last patient, Mrs. Marks, had her right leg amputated above the knee because of gangrene. She knew even before the operation that the aim was to restore full mobility with an artificial limb. Old people withstand operations very well. Experts at the Limb Fitting Centre are responsible for the careful manufacture and fitting. This is a good example of sophisticated mechanical skills being brought to the service of an old person who would otherwise be grossly disabled. With help, she takes her first steps on the new leg. She can get out of a chair unaided and learns to walk with a frame. Soon, she will be back in her own home. There is quite a festive spirit at Christmas time for inpatients and outpatients alike. Old acquaintances meet at the day hospital party. They discuss progress and their hopes for the coming year. Many of them will continue to see each other when they come for follow-up treatment. Miss Clark has finished rehabbing for her stroke. She is very excited as she leaves hospital to go home to her family. She exemplifies the main purpose of geriatric medicine, which is to restore the maximum degree of independence and dignity to older patients and enable them to return to an active and enjoyable life in the community.